Jackie Yager joins us today from Gundersen Health System. She is the Hospice Medical Director, and she's here to talk to us about end-of-life care, which also includes hospice, and also something that's called palliative care. So first of all, Jackie, when it comes to hospice, a lot of people understand that that's sort of your end-of-life care. You've stopped trying to treat the disease and trying to keep that person comfortable. But when it comes to palliative care, what is that compared to hospice?
Well, palliative care is also a specialty that focuses on treating symptoms and really getting people to the point where they can enjoy their good quality of life, but maybe also during treatment, such as chemotherapy. And some of those patients do well and never need to go on to hospice. Other patients may have several years of palliative care while they're treating the disease, and then at some point may begin to fail, and palliative care can help their family then transition to a hospice concept of total comfort care.
And this is one of those topics that's hard for families to talk about. It's not a comfortable thing to talk about, but it really is a good thing to give some thought to, you know, even if you're not to that point. And it's something that even at Gundersen, you can have someone go to their home and meet with them about it first.
Right. We can do an informational visit from our hospice to sit down with you and your family and really talk about at what point would hospice be beneficial.
Okay, and this is where living wills can really come in very handy as well, because that's giving your whole family kind of the directives that you want for your end-of-life care. What are some of the things that are taken into consideration when it comes to palliative care or hospice care? What are some of the things that as a team at Gundersen they sort of work with the patient on to make sure they're taking care of all those different needs? What kind of things are we talking about beyond medication?
Right, I mean, I think I like to say we sort of throw out some of the rules at that point and say, well, what's really most important to you? And if it means that what's most important is to conserve my energy so that I can go to my grandson's baseball game, then we all kind of focus on how are we going to make that happen.
I was going to say, my dad was one of those people in those situations, and they'd really cut his diet back. No salt, no sugar, no anything. And it got to a point where, you know what, if he really wants to have that spaghetti dinner, or he really wants to have, that's fine. So there are some things that you do. You change the rules a little bit. So
you stop a lot of medications.
Yeah, so they feel the
necessary.
best. All right, so when someone comes to your house, we should keep this in mind, that hospice, palliative care don't necessarily have to happen just in the hospital setting.
Correct. In fact, 95% of our hospice patients are cared for in the home or in the nursing home. There's only a small percentage that are in the hospital, and that's only to deal with symptoms that are not being controlled in the home. Sometimes we'll have them in the hospital for a short period of time. But most of what hospice is about is trying to keep people in their home. For a lot of people, that's a nursing home, but keeping them at home, supporting the caregivers in order to make that happen.
Very good. Thanks a lot, Jackie, so much for joining us today, too.